put an end to the 15-year-long wait, because this policy was first framed back in 2002 and it could finally, as Ritu was saying, see the light of the day. What would that mean? Archana Shukla now joins in to give us the key highlights from what we can expect. So Archana, should we expect now healthcare to get cheaper, especially for those in need of it?
Well, you know, if you see the stance of the government in the last 2 years or so has been to push for more affordable healthcare. While on the budget front, they have on a central level cut down on expenditure in the last 2 or 3 budgets that we've seen. But the positioning now that they are going ahead with the national health policy is to make it more affordable. The first thing that even Rituparna Bhuyan talked about was increasing expenditure on healthcare, the government expenditure. In 2002, when this draft policy was first spoken about, the national health policy, they had mandated it to increase to 2% of GDP. We were not able to even achieve that. But the draft policy in 2015 that was brought in suggested that the public expenditure should increase to 2.5% of GDP at least, which is 3,800 rupees per capita. So that is what is expected in the national health policy, and that is what will solve a lot of issues plaguing particularly the public health sector in India in terms of infrastructure, in terms of manpower, and a lot of expensive diagnostic and healthcare services which people go to the private sector can be taken care by the public sector itself. Now, the draft health policy itself suggests that the cost of healthcare in India is so high that almost 60 million people fall into poverty annually, and this is possibly what the government has to fight now to bring down the cost of healthcare, for which they are saying the draft policy also highlights that it is not only the public sector that will work towards it, it has to be the private sector also, and which is where, like Rituparna pointed out, public-private partnerships would be the way forward, and they're trying to delve into this. Now, in terms of how they would meet the expenditure on healthcare, the increased one would solely not be through the tax. Tax would be the prime source, but they're also looking at other forms of financing healthcare costs in India to cover 70% of the vulnerable population. We also understand that the government is talking of a health scheme which will cover the vulnerable population, and how they will demarcate them. They have fixed possibly 1,640 rupees per month as the monthly income in the rural sector, and 2,500 rupees per month in the urban sector, which is how they would demarcate. Also, just one last point that I would want to mention, the government's stance on making healthcare affordable has also been seen on the drug side, where recent decisions on cutting prices or capping prices of stents was one, and second is also they are pushing on the Jan Aushadhi and the Amrit stores, which if they can expand that purview, even pharmaceutical costs and burden on healthcare from that sector could be handled. Back to you.
All right.